Hello everyone, I'm Chiara Pavron and this is my PowerPoint on how to scan for splenomegaly. So what we'll review in this PowerPoint is we'll talk about the literature, indications for scanning a spleen, the protocol for the study, and some pathology. Okay, so we'll go ahead and start with our literature review. For some brief overview, our spleen sits in the left upper quadrant as an intraperitoneal organ made of red and white pulp. It's our largest secondary lymphoid organ, and its shape can be molded by the organs and tissue surrounding it. Multiple factors contribute to its size, including many disease states, but hepatic disease, infectious agents are all just to name a few. From the literature, we know that splenomegaly is easily missed on physical exam. We're not the best at catching it. And ultrasound is actually more sensitive in diagnosing splenomegaly than physical assessment alone. And both in the adult population and pediatric population, the normal spleen should decrease with age. So reasons to go ahead and do this exam, besides the ease of exam, would be if you felt new splenomegaly on your physical exam. If there are conditions on your differential that would alter your patient's outcomes significantly, that would be a reason. If they just received a new diagnosis that could compromise their splenic architecture, that would be a great reason. If there are other organ systems affecting your differential and you would like to assess those, that would also be a great reason. And if you're suspicious for any kind of malignancy, have red flags for that. That would be a great reason to scan as well. So now we'll go into our scanning protocol. For completion, whenever you're assessing for splenomegaly, especially on ultrasound, you should also get some images of the liver because splenomegaly and hepatomegaly can go hand in hand and you wouldn't want to miss anything on your differential. So if you watch along in this video, I'll be using a butterfly probe in the abdomen setting. But if you're using a different machine, you would want to be using a curvilinear probe for both exams. For the liver exam, you're going to want your patient supine. You're going to be taking a lateral approach, scanning at the mid-axillary line between the 10th and 11th intercostal space, obviously with the indicator to the patient's head. For this scan, things you're going to want to visualize are the diaphragm, the liver, and the right kidney, all in long axis. Once you have obtained that, you can kind of see me do that in the video. You're going to want to freeze the image and measure the liver from the diaphragmatic surface to the inferior border, and then we'll talk about cutoffs for normal in the next slides. And some tips for this scan is you can have your patient place their right arm under their head like they're relaxing at the beach to kind of open up those intercostal spaces. Similarly, you can have them hold a deep breath and always do your best to get in between those intercostal spaces. Trouble with this scan is if your window is kind of narrow, you might not visualize the entirety of the liver's diaphragmatic surface and tip all together at once on the screen. This can lead to overestimation or underestimation in your measurements. Okay, so now we're going to talk about scanning our spleen. So again, you're going to have your patient supine, and this one actually takes more of a posterior lateral approach, but also intercostal around that 10th rib again. First, you're going to want to get a longitudinal view. You're going to have your probe aligned with the intercostal space. Once you get everything in a good picture, you'll freeze, you'll measure your spleen. You should get a crescent moon shape with the indicator to the head and right shoulder appropriately. Then we're going to turn our probe 90 degrees, and that crescent moon should flip over in your transverse image. For a complete spleen image, you should always assess for color flow, and we'll talk about why next in the pathology slide. Some tips for this scan: it can be a little bit elusive, so sometimes it could help to roll your patient onto their right side to eliminate bowel from your view. You could have your patient take a deep breath, push the spleen down, or just move up and down rib spaces as needed. Some dangers in this study is if you're scanning too much anteriorly, you might get too much gas in the way. And then when you're scanning transversely, you can get too much rib obstruction. And then if you have your patient holding in a very deep breath, you can actually get lung artifact in the picture. So it might be better to ask them to just hold their breath mid-inspiration. So first we'll talk about some pathology for the liver. So in our video we just saw, the liver should be homogeneous in echo texture and echogenicity. It should be similar in brightness to the renal cortex and smooth and capsular. So like most organs, the size will depend on age, gender, and body size. But for adults, hepatomegaly starts once your length is greater than or equal to 16 centimeters. For children, it's age dependent. So here's a nice table breaking down the limits of normal in that right-sided column. And then here's a table about liver pathology, which I won't read to you because this video is supposed to be about spleen pathology. Okay, so now to discuss spleen pathology. Just to discuss why we want color flow, you want your spleen to be uniform in shape, size, echo texture, and you want to see vessels radiating and converging at the hilum while you're fanning through. Your spleen should be homogeneous and should have homogeneous parenchyma with mid to low level echogenicity. That second bullet point is kind of discussing things you can find on ultrasound, including splenic masses, cystic masses, granulomas. And then in terms of diagnosing something just from ultrasound alone, if your patient fits all other presenting symptoms that you would expect, and they have on ultrasound the combination of splenomegaly, a nodular liver edge, and ascites, you can go ahead and diagnose cirrhosis with portal hypertension, which I thought was pretty neat. Overall, kind of like we implied earlier, this study is kind of just to tell us yes, no, the presence of splenomegaly, and kind of your patient's symptoms will guide your workup and further management. So if you're suspecting mono and you want to assess if contact sports are safe for your patient, you can go ahead and get the scan and make a decision right then and there. If your patient has kind of more systemic symptoms and you're thinking of a HIV, TB, malaria kind of picture, or maybe a malignancy picture, or if they have a new diagnosis of an infiltrative disease like sarcoidosis, amyloidosis, or a storage disease. This is all examples of when your spleen ultrasound would be helpful. So to quickly just talk about some number cutoffs for normal spleen. So an adult, less than 13 centimeters would be normal. The cutoff is starting at 14 centimeters for splenomegaly. Anywhere from 14 to 20 is considered moderately enlarged, and greater than 20 centimeters is a severely enlarged spleen. In children, when you go ahead and scan the left kidney, if the spleen is more than 1.25 times longer than that kidney, then you can also go ahead and call splenomegaly, which is quite interesting. So for completion's sake, in a pediatric scan, you would also want to do a renal scan, which I will not be discussing in this PowerPoint for time's sake. But here you can also see in the most right side of the column, normal expected ranges for a spleen size in children. And this is just a nice table putting together kind of the table we saw on the previous slide. This is from a study done in Caucasians showing the cutoffs between normal and splenomegaly. And here are my references. I hope you enjoyed.